Hey guys, what's going on? This is John from Friends with Your Benefits. It's been said that employers in the US pay the most for healthcare than anywhere else in the world. And today we're going to discuss why that is and also some opportunities that employers can take to actually reduce their healthcare spend without shifting costs to employees. Joining us today to learn a little bit more about that, we have Jesse Irvin from Carrum Health. Hey Jesse, how's it going? Welcome to the show.
Thanks so much, John. It's going great. Thanks for having me.
Of course. So, Jesse, before we get started, why don't you tell our audience a little bit about your background and perhaps a fun fact that a viewer out there might not know about you?
Yeah, absolutely. So I think like many of us in the employee benefits space, I never intended to get into employee benefits. It's kind of a universal trait that a lot of us share. I'm originally from a pretty rural town in Pennsylvania, and actually coming out of high school, my true passion was culinary arts. So coming out of high school, I enrolled in culinary school, Punxsutawney, Pennsylvania. Shout out to the groundhog. And after culinary school, I cooked professionally for several years. But there's an old saying in the culinary realm that is, if you can't take the heat, you got to get out of the kitchen. And it became pretty clear a few years in that that wasn't the lifestyle of the career that I wanted to have long term. So I actually went back, finished my education, and through kind of a serendipitous turn of events, landed at Mercer. So I started as an analyst at Mercer back in 2015 and worked my way through a variety of different roles there in ben admin, operations, and core consulting. So a wealth of knowledge was imparted on me, a really great basis around employee benefits. And then earlier this year in January, I had the opportunity to come on and work with Carrum or work for Carrum, and just super impressed and passionate about our mission here to really shift kind of the prevalent fee for service model into value based care. So thrilled I made the transition, and excited to be here talking to you today, John.
Cool. And we may have to have you back to talk about healthy meals that you can have for your health and well being. So perhaps that will be a part two down the road.
Yeah, it sounds great.
So, Jesse, let's dive right into it, right? So, as I mentioned at the top of our episode here, payers within the healthcare space in the US pay more for healthcare than pretty much anywhere else in the developed world. So, why is that? Can you give our viewers some insight into that?
Yeah, I think however you slice it, John, we really don't have a great reputation here in this country when it comes to healthcare. There's not a ton of transparency. We're actually fairly complex, and sometimes, unfortunately, we're actually intentionally complicated. Even for people in benefits, I'm on my wife's insurance. She's a teacher. She has wonderful coverage. We just went through open enrollment with her plan, and even for me, who has over a decade in the benefits space, it is a complicated and convoluted process to understand the benefits that your plan offers. And if you ever follow me on LinkedIn, you've seen me rail against this in a multitude of different ways. The way I like to describe it is that the healthcare system in the US is really a huge jigsaw puzzle, and there's a lot of different components and pieces that kind of drive what we see as issues. But for today, what I'd really like to focus on is the fee for service model that's really prevalent in this country. And unfortunately, under the fee for service model, it's creating this base incentive for providers, facilities, and surgeons to push more tests, more procedures, and more treatments that may or may not actually correlate to a patient's care, quality of care, or actual final outcome. So, what we would really love to see in this country is a shift from that fee for service model that's creating this base incentive to possibly push procedures that might not be necessary, to really correlate care to a value based care model where we're actually rewarding providers, facilities, and surgeons by the patient outcomes that they're experiencing and achieving.
So that's very interesting there. And I guess just to kind of summarize, what you're seeing, at least on the surgical side, is there's really no correlation between price and quality as it relates to many surgical procedures out there, right?
Spot on, John. There's really no correlation in the fee for service model to a quality outcome and the cost associated with that patient.
So let's walk into what exactly is Carum and how did Carum actually get its name?
Yeah, let's start with the name, John, just because I think it's fun. So, carom actually comes from Latin roots and it means push cart.
Hmm.
And we did that because what we're trying to set up here and what we're working towards is a true marketplace or a true shopping experience to give both our clients and our patients choice when it comes to their care. And then while we're on the care bit, obviously Carrum has phonetically the word care in it, and that correlates really well with our mission to transition the US healthcare system to value-based care. So on that particular point, that's how we got our name. But when we look at what we're actually doing, we're transforming how surgical and cancer care is delivered, experienced, and paid for in this country. And we're doing it by connecting employers to top providers across the country for really high value episodes of care. So we're actually going out and we're contracting directly with these providers on, fully pre-negotiated, fully bundled agreements for each of these surgical episodes and cancer treatments. And it's really wonderful that we're able to achieve this. No one else is coming even close to what we're able to offer in this space.
So speaking of provider contracting, right? I mean, essentially there's four big players, right? We call them the big four. How are you guys able to get better rates than the big four, which largely dominate the health insurance marketplace?
Yeah, I mean, as you can imagine, John, I get this question all the time. And there's a variety of reasons, but the main one is the fact that because we're offering these really bundled agreements that are all prospective, we're streamlining the administration for these providers. So they don't have to track people down for their deductibles. They don't have to, go back and forth with the carriers for allowed amounts and incurred charges. So the streamlined administration piece really does help when we're negotiating with these providers directly. Another piece of that is we're actually bringing in net new business for some of these facilities because we're bringing in people from outside of their typical geographical area. So we are bringing in some new business for them as well, which certainly helps. And then lastly, although I certainly wouldn't categorize this as a main driver, we're starting to see a big shift in some surgeons who are coming to us for altruistic reasons, who want to be involved in this shift to value-based care. So there's a variety of reasons, but the main one would be streamlined administration and then the net new business via bringing people in from outside the typical geographical arena for these particular providers.
Walk me through what the employee experience is like, right? So if I think of like narrow networks, right? I don't know if that's a fair analogy or not. Like I kind of think, hey, is that a fair analogy, or is it like the old HMO days, or is it something that's totally different? So walk me through how your product's a little different.
Yeah, absolutely. So I don't think that narrow networks are a fair comparison to Carrum, mainly because narrow networks are not actually correlated to patient outcomes or quality. And in most cases, narrow networks are still fee for service at the end of the day. And it's just a carved down network that the carrier is offering. But at the end of the day, again, we're not getting that same quality metrics that you're going to get through Carrum. So at Carrum, we really like to handhold the patients through every single step of the way. And when you look at the Net Promoter Score or NPS of patients who go through surgery outside of Carrum, meaning they go to their PCP, they get their referral, they're going and figuring kind of everything out on their own, the resulting NPS for that is really abysmal. Typically in the single digits, we're talking 6, 7, 8. And when someone's coming through the Carrum program and solution, we're consistently achieving above an 80 for NPS. And when you look at the fact that 70 is considered world class, like we're blowing that out of the water. And we're doing this in a multitude of different ways. But as I was saying just a moment ago, we're really hand holding these people every single step of the way. We have what are called our patient care representatives. And from the moment someone enters our program to the moment they are through post-op recovery and are get tied back into a client's ecosystem, our patient care representatives are assisting them every single step of the way. To be clear, this is a one-to-one assignment. So this person is with their patient care representative from the beginning to the end of their surgical episode. And for our cancer, episodes, that could be up to a couple of years. So there's real relationships that are built with these patient care representatives. We see vacation pictures, Christmas cards, gift baskets. It's really wonderful to see the relationships that are being built. And at the same time, because this is a one-to-one relationship, it really streamlines the patient experience because you always know there's one person you can talk to who knows what's going on. You don't have to call 16 different people and explain yourself 16 different times. And you don't have to call into a call center and wait for someone to spend 10 minutes to catch up on all your notes and figure out what's going on to help you. So we really do wrap up the actual surgical procedure with a bunch of assistance, hand holding, etc. The other piece that I think is more behind the scenes is the fact that in many cases, employees are not paying a cent for this procedure at some of the best, quality providers in the country. So there's a huge incentive for patients to capitalize on Carrum because they're going to get the best possible quality with the best possible experience at potentially no cost to them.
So you definitely said a few things I just want to circle back with there. So let's say an employer out there decides to offer Carom to their employees. Like, how do they find Carom? Like, is it a 1-800 number? Is it an app? Like, how does the initial touch base actually happen from the employee who may have some form of an electable surgery?
Yeah, that's a great question. So, when we're talking about employee engagement and outreach, we really have a tried and true engagement book. We actually ingest medical claims data from the medical care and we look for surgery precursors in data. So, when we're doing this, we're making sure that we are, again, we're not being big brotherish. We're not saying, hey, we just saw you got an MRI or, a cortisone shot. We really want to make sure that we're getting these people to the right place at the right time. And as I'm sure you know, John, less than 10% of any given population is going to have a major surgery in a given year. So while we can do, broad communications to let people know about Carrum, and we certainly do, we bracket that in with additional communications based on claims ingestion. And that really does improve our outreach as far as encouraging people to use the program. There's also a couple of different levers that you can choose when it comes to plan design. So some of our clients actually choose to make certain high cost procedures available only through Karen.
Okay.
So, for instance, we do have some clients that set up that total joint replacement, spinal fusion, or bariatrics would only be available through Karen. And that certainly is one lever that they can pull to ensure that employees are getting the best possible care while at the same time ensuring utilization and cost savings for the employer side.
So one thing that I thought was really appealing that you had mentioned was that Carom is available at essentially a $0 copay for employees. So
Mhm.
you may have seen some of our videos out there on HSAs, right? So I believe these procedures, right, are generally not going to be preventive in nature. So how is Carom compliant with the HSA regs that are out there?
Yeah, absolutely. So if you're in a PPO plan, obviously across the board, all of our clients have incentivized employees to use Carum by waiving copayments, coinsurance, and obviously covering travel as well. But when it comes to high deductible health plans, in order to be compliant with the IRS, what our clients are doing today is actually taking the IRS minimum. And then after that IRS minimum is met, they're waiving the remaining deductible, if there is any. And then, similar to the PPO plan, they're waiving any co-insurance cost share and covering travel as well to, again, incentivize people to use these plans. So that's how we work with the high deductible health plan members. But there's still a lot of savings to be had. And in fact, we've actually seen that high deductible health plan members are even more likely to use Carum than some of the PPO plan members.
Yeah, it makes sense. If you're going to have a lower out-of-pocket cost, potentially not needing to meet your entire deductible, that could be a huge win for the employees, and it also results in additional money staying in the health savings account. So, very interesting perspective there. So, you touched on some of the procedures, but like, what are like the universe of procedures that are available through Carum today?
Yeah, it's a good question, John. So, right now, what we're focused on correlates with the highest spend that employers are experiencing. And I think it goes without saying that right now, that's cancer. So, we cover cancer, both treatment and guidance. Under our treatment bundles, we're currently covering in 2023 thyroid, CAR T, and non metastatic breast cancer. Next year, we're adding colorectal, prostate, and gynecological cancers as well. And then we understand that, again, that's about 60% of the high prevalence cancers in the country, but we understand that there's still other cancers out there. So we also run a guidance program, and that guidance program will cover virtually everyone from anywhere in the country with any cancer at any stage. So it's really wonderful. I kind of categorize them as two halves of the same coin. The treatment and the guidance piece work really well hand in hand to ensure that we have a really robust cancer offering. And for our treatment bundles, it's really one of a kind. No one else is coming close to a fully bundled, fully prospective cancer treatment bundle. Then, in addition to cancer, we really focus on MSK, and that would include spinal procedures, total joint replacement, as well as sports medicine, so soft tissue injuries, and then bariatrics and cardiovascular as well. So that's really the main focus that we're working on now. And we're doing that again because those categories are what typically drive the highest amount of surgical spend for employers.
So, Jesse, what levers do employers have if they really want to maximize the Carrum offering?
One of the things that employers can do, if they so choose, is to make certain procedures only available through Carrum. And again, this would be a specific subset of the offerings that we cover. Typically, what we see is clients would pick from total joint replacement, spinal fusion, or bariatrics. And when clients are picking these types of procedures, there's really two reasons for it. So, first and foremost, these are really invasive, high cost procedures that have a high rate of complication. So, from a quality and return to work perspective, it's a wonderful thing to make available only through Carrum because you're assured that based on our quality metrics, they're going to get the best possible care and they're going to be able to return to work more quickly. The RAND Corporation, as well as validating our surgery avoidance rate of 30% and our average savings of 45%, they were able to validate that we have a 80% reduction in readmissions over the open market. So when we're talking about, really invasive, complicated procedures, it really makes sense to have your patients and employees go to the best possible person in the area. And at the same time, because these are such high cost procedures, you're actually able to ensure both utilization and cost savings when it comes to these types of procedures as well. So you're actually getting better quality procedures done with a better patient experience for about half the typical cost, which is really wonderful when it comes right down to it.
Yeah, and employers out there are definitely going to like that, right? That is the double win right there, where the employees potentially have a much lower or no out of pocket cost, and then the
Yeah.
employers see a reduction in cost, which hopefully leads to lower employee contributions in the future, right? So you've said some very exciting things about where Carrum is today. Where do you envision Carrum going in the future?
Yeah, so you're probably aware of this, John, but your viewers might not be. We just finished our Series B round, and it was an up round. We were very excited about this, but we've actually made a pledge that the majority of those funds are going to go to expand our oncology offering. And our oncology offering is exciting for us because I think it goes without saying, cancer is one of the number one cost drivers that clients are going to need to focus on over the next decade or so. So, really, right now, for the next several years, we're going to be expanding both our network and the cancer treatment bundles that we're offering. So, that's certainly our focus right now.
Jesse, let's say there's someone out there, they want to learn a little bit more about Carrum, or perhaps they want to connect with you directly. Where can they go?
Yeah, so we have a wealth of resources on our website, www.carrumhealth.com. And you can actually chat directly with a representative on the website. Also, if you want to reach out to me directly, you can find me on LinkedIn. I respond to LinkedIn messages within 24 hours. And I also have placed my work email in my contact information on LinkedIn. So please feel free to reach out to me at any point with any types of questions. More than happy to assist or at least get you to the right place.
Awesome. Well, Jesse, thank you so much for coming on the show today. Really appreciate it.
Yeah, thanks so much for having me, John. This was great. Thanks again.
Of course. And for our viewers out there, we want to hear from you. What innovative solutions have you seen in the healthcare space? Comment below.